All right, it's 2 o'clock. Welcome to Soft Money, Opportunities for Health Tech Startups in Denmark. I'm Jesper Grønbæk, and I'm here to facilitate this afternoon. Welcome to 2 hours, who might be the best 2 hours you have spent for a very long time, seen from a return of investment perspective. I hope we can enable you to realize the innovation you have had in mind for some time, or grow the startup you're already working in. A bit of background. I'm Jesper Grønbæk. I'm the CEO and founder of Health Tech Hub Copenhagen, where I work together with a team of really great people. I worked in the commercial software industry for 20 years, and I worked with many commercial investors and founders, and I've helped them fight for commercial money for all this for the last 20 years. I've also raised money myself from commercial investors from my own startups, and have seen and experienced on my own body how hard this can be. When I entered into health tech 3 years ago full time, I was shocked by this new word, soft money. I've never heard of it. What is soft money? And somebody explained to me that soft money is a term used for funding that's mostly given or awarded to your company, but always without giving away any ownership of your business. That sounds almost to be too good to be true. I and the team at Health Tech Hub Copenhagen have now the last 3 years met and helped a number of great startups within health tech that has been good enough to attract significant amounts of soft money, often up to $1 million, but also a handful that has raised more than 20 million from soft money without giving away any percentage of their equity. This is really awesome. And needless to say, this also leaves founders in a much better position when commercial investors are needed. Today, we are really lucky to have the largest players in terms of great advisors, experts, networks, in giving grants and awards and loans and soft money to present to you. It's actually a little bit of absurd. There are actually significant soft money available, especially for very early startups. However, way too few startups are aware of all the possibilities. And that's our goal of today, to make you aware of all the options available and give you a bit of guidance to increase your chances of success, which is at the core of what the Health Tech Hub tries to do. I also want to thank our commercial partners who makes this possible for us. Innovationsfonden, who's our biggest backer, Dansk Industri, Roche, and Netcompany. I will also just introduce you briefly the agenda. We'll have first we'll have the Novo Nordisk Foundation, Rasmus and Karen, to present for 15 minutes, and then there'll be 5 minutes of Q&A. You will be able to ask your questions in the chat. So please ask them in the chat while they're speaking, or if you already have a question, you can also feel free to already ask it in the chat, and we'll look at them. And we'll try to answer as many of them as possible. Then we'll have Marcus from the Bioinnovation Institute, who will do a similar talk. And then we'll have Sten from Innovationsfonden Denmark. And then he will be followed by Christos and Per from EIT Health. And then at the end of it, we'll also have 20 minutes for general Q&A for all the presenters, or general discussion. And then at the end, I will try to conclude and give you some key takeaways and next steps. Okay. With these words, I will make the floor available for Karen and Rasmus.
Yeah, so thank you very much, Jesper, for the introduction. It's a pleasure to be here at this event. We're really looking forward to see the rest of the presentations. We are two from the Novo Nordisk Foundation. We are Karen from the Innovation Department and myself from the Biomedical Department. I will start talking a little bit about the foundation in general and a little bit about what we mean basic research money. And Karen will take over and tell you more about innovation grant opportunities. So without further ado, let's move on. So first of all, what is the Novo Nordisk Foundation all about? Well, the purpose really is to contribute significantly to research and development that improves the lives of people and the sustainability of society. And we try to accomplish that following 3 main objectives. First is to provide support and enable our companies, Nordisk and Novozymes companies, to create world-class business results. Second one is to develop knowledge-based research and other environments in Denmark that allows innovative and talented people to, well, find tomorrow's new treatments and solutions. Finally, one of our objectives is to inspire and enable children and young people to learn, and particularly within the, you can say, STEM areas, but in general, broadly, interest and discoveries. But what is the Novo Nordisk Foundation? Well, the Novo Nordisk Foundation is a private, independent enterprise foundation. What does it mean it is an enterprise foundation? Briefly, it means that we own controlling ownership of companies. And you know the two companies of the Novo Group, the Novo Nordisk AS and Novozymes AS. The way it works is that dividends from these companies go up into our holding company, Novo Holdings, that performs a range of large and small investments, also relevant for you in this audience. They're very good at that. You can see 2019 data, they had plus 26 billion Danish crowns. And dividends from there go up into the foundation, where we provide grants that we will hear a little bit more about today, primarily in the Danish research and healthcare environment. Very briefly in numbers, these are for 2019. I apologize, we do not have the 2020 numbers yet, but how it looks like was in 19, we were able to award almost 5 billion Danish crowns and paid out, well, only 3.6, since of course the payouts follow a bit slower after the awards. But that meant that we could award more than 600 grants with a success rate of just above 18%. Of course, a success rate that we would like to see increase, but which is always a balance, of course, between smaller and larger grants. We received, you can see, more than 3,000 applications, and that has only gone up since 2019. Let me just change the slide here. We experienced some common, you can say we have some common questions, common mistakes when applying for grants in the Novo Nordisk Foundation, which has resulted in us listing some of these general considerations you should take into account when you apply for foundation money or for grants from the Novo Nordisk Foundation. First of all, and this might be something you think, well, then it's irrelevant for us, but I still hope that for the part that I'll tell about, even though it's basic research funding, it is still very important for startups, for new findings. You can go back to basic research and test findings, even if you sit with a company. So the first point is that we support non-profit projects only, primarily universities, hospitals, GTS, and so on. And we support funding prior to company creation, which of course is very important in this context. If you are a recipient of a number of very large grants, that can, all other equal, be taken into considerations when you apply for us. And we do not give feedback if applications are rejected. That's something we get a lot of questions about, and I can happily say that it's something we're working a lot on to improve. We hope in the future to be able to give reasonable feedback to applications. So in order for you guys and for other researchers to be able to apply better in any future applications. And really the reasons we do not do it is simply capacity to be able to do it. We do not cover overhead expenses, so indirect expenses we are not allowed to cover, but we do allow that you can apply for what we call an administration fee, which can be up to 5% of any grant, and that it is to control, to do accounting, for hiring, the process of hiring people, and so on. So non-research expenses. And it's important to say also that the Novo Nordisk Foundation does not only support research in diabetes. You do not, we have the questions sometimes, where should I write diabetes in my application? that is not necessary. I think in open competition, it's perhaps between 15 and 20% that goes to diabetes research, but the rest to any other field really in health and, well, biotechnology and biomedicine and so on. About applying or the application itself, well, I've written here scientific excellence is the main assessment criterion. That should be understood broadly. So it is the quality of the idea, the promise, the potential of a research idea, how feasible it is when that's relevant. There can be other criteria where it's really the opportunities that will be assessed on. Of course, the applicant, him or herself, will also be taken into consideration, and so on. But those are the main criteria for most of the Novo Foundation applications. When you apply, remember to work on form, structure, language, figure. How does it look? It does matter. It is not only about the hardcore facts. Do think about how your application look like when other people have to read it. Unfortunately, it can have an effect. It also leads a little bit to that there is no such thing as good enough. If you apply, if you're not used to that, it's not a checklist. Do not just fill in what is required in the call. That is not necessarily good enough. We have plenty of very, very excellent researchers applying and fantastic research projects. Well, so many that we cannot support all the good ones. So remember to think that you are in a competition when you apply for these research money. Finally, remember experts are only human. I'm saying that because we have this almost 30 research expert committees that assess all the applications we receive, and they cannot be experts in any possible subject in the world. So be aware to not be too specific, too detailed within your research field or innovation opportunity or idea. Remember to explain what this means in broader terms. My last slide here before Karen takes over is just to present what I call basic research grants. And that sounds maybe a little bit too far away from what you were interested in, but I picked these ones out of the long list of grants we actually have, with the focus on things that can be used, to test things that could have the very first project grants is a little bit our bread and butter grants, smaller grants up to 3 years, 1 million per year. You can see the deadlines, June, September out here for all the grants. We have our investigator-initiated clinical trials to test any new drugs, medicine, technology, device, can even be surgery, can even be physiotherapy treatment, which actually is large grants, up to 20 million per grant for up to 3 years. Data science program that includes a list of different kind of opportunities. Somebody is eating with the microphone on, I think. And the first one here is investigator, it's called. It's actually 3 stages, 3 different career levels where you can apply for up to 10 million for 5 years, personal grants. It's excellent to apply for. There's a lot of interest in these. We also have collaborative projects in data science, up to 4 research groups going together, up to 25 million per grant, up to 5 years. And finally, research infrastructure and data science, but where you have to apply, you have to explain how you'll get access to the rest of the country, actually, for this infrastructure, up to 15 million for 5 years. I should say about this data science program, it's really about developing new data. It's focused on data science and data scientists. So new algorithms, new infrastructure that will support that field. So it's not really to support other areas, which is often the case. It is to support and develop the data science in itself. Tandem program is really a collaboration. What we want here is a close collaboration between basic science and clinical research. So it's a translational thing. We can say you have a finding in the lab, for example. You can go together with a clinical researcher to have it tested in the clinic. Very popular program. Important is to explain how this is a collaboration and not 2 separate research lines. Here it's up to 10 million Danish crowns for 4 years. Finally, the Interdisciplinary Synergy Program, which also has a smaller grant that comes before, it's called the Exploratory Interdisciplinary Research Synergy Program. This is where you test completely new ideas, crazy ideas that goes across different disciplines. Here, feasibility, for example, is not an issue. It is really about the potential of the idea. And we talk about any discipline in research, actually. It's a mistake here that say 5 years. It's 5 to 15 million for 3 or 4 years research projects. That was the very quick version. We do not have so much time, and straight to Karin. Thank you.
Thank you, Rasmus. I'll let you move to the next slide. And I'll continue with the more innovation-focused grants. So as you may know, the Novo Nordisk Foundation has increased its focus on innovation the last 10 or 5 years at least, not just with the spinning out BII, which we'll talk later, but also with setting up an innovation department at the foundation. And the innovation department is governing 2 different grants, the Pioneer Innovator Grant and the Distinguished Innovator Grant. The Pioneer Innovator Grant is actually more or less the same as the prior Exploratory Pre-Seed Grant that some of you may have heard of. And the general basics and the guidelines around this is very much the same for both grants. So both of the grants have a purpose to accelerate commercialization of research findings and development of novel solutions within the health sciences. And when we say health sciences, we mean pharma, medtech, and industrial biotech. And so the difference here between the Pioneer and the Distinguished Innovator Grant is, as you can see, both on the budget side. A Pioneer Innovator Grant, you can apply for up to 1 million Danish kroner in total for 1 year. And the Distinguished Innovator is up to 6 million Danish kroner in total for 3 years. The geography is also different. We have a lot of Nordic researchers applying for the Pioneer Innovator Grants. We would, of course, like to see even more applications coming in from Denmark. And for the Distinguished Innovator Grant, it's currently only for Denmark. The main difference here is the eligibility between the 2 grants. And in both cases, you have to be a research leader employed at the university. But the difference here is really with the Distinguished Innovator Grants, as it sounds, it's for distinguished innovators, meaning leaders and researchers who already have a proven track record within innovation. They've shown to be able to spin out projects, to put in new patents and license agreements for their research projects. And here's the really difference. Both grants is about creating new ambassadors that can be symbols for innovation in the academia. But the Distinguished Innovator is, of course, even a larger grant and even a larger symbolic value with this ambassador behind it. Rasmus, do you want to continue? Yeah, and I can just emphasize here again, the deadline for both of these grants is March 15. And the next round will be in after the summer. So there we have 2 rounds per year. And I just want to go through some of the frequently asked questions for these 2 grants. Many people ask, what is the funding for commercial activities? Well, that is actually any relevant commercial activity for the project, such as cost for consultants, experts within commercialization, patents, licensing, etc. And this is actually only for the innovation grant, not for the basic grants that Rasmus previously presented. And then what about the majority of the projects? Well, we usually say that you need to show preliminary data, basic infrastructure and technology, and a team that could pursue the project. And the stage should be around proof of concept, so prior to or at the stage of proof of concept. You can have a patent and license, that's all good actually, to show that you already thought about your commercial process going forward. And again, novelty and commercial potential is really important for both grants. And also I many times get the question, of course, and it's very much relevant for you listening to this, if a project can apply that's already associated with, or if a company has formed around the project. And that is not the case for the Novo Nordisk Foundation. In that case, I would ask you to contact the Bioinnovation Institute presenting after us. And the application is confidential, yes, but we do publish the popular abstract. And there's also an announcement on our webpage with all the awarded grants. So you can go in and see who has been awarded over the last couple of years. Then we can move on to the last slide. So this is really just a question slide. I think it's time for questions. You have both Rasmus and my email addresses if you want to contact us after the seminar.
Thank you, Karin and Rasmus. Great overview and so many opportunities for early pre-startups, if you can say, and innovators at universities. Any questions in the chat? Please ask your questions in the chat. If you have any questions for Karin and Rasmus. While the only question I saw was Louise, in terms of, obviously, as you also, I think you very rightly pointed out, your grants are not for existing startups. However, I've seen, and maybe that's it's nice to see, is that we've seen startups who have started, researchers who've started from universities, have had a grant from the Novo Nordisk Foundation to actually explore their innovations and build clinical trials and tests and evidence, and then later spun out into a commercial company. And I guess that's also the purpose of many of your grants, is that you want them to turn into commercial entities eventually, but you're not supporting that. Isn't that correct?
Yes, exactly. I mean, it's not that we are not interested in commercial opportunities. We are certainly interested in and certainly hope for the best outcomes of the grants that we support, that are more basic research and also anything prior to company creation. And we should say we also have a number of other activities to assist in education and so on at earlier and later stages within innovation. So. Yes, there's certainly no problem in in commercial potential and development further on. And we have, as you will also see now, BII is really one next step to take after fundamental research grants, basic research ideas have been developed. And there is, of course, our holding company, Novo Holdings, that has also investors that look out for excellent opportunities and ideas in the research environment.
Yes. There's one question in the chat in terms of funding opportunities for students. Can you be a student at a university, or do you have to be an employer at a university to get to seek a grant?
Maybe I can, or do you want to take that, Rasmus? I mean,
you can.
Of course, you can be a student. I usually tell, at least for the innovation grants, that to have a better impact, I would encourage to have a main applicant that has a more senior position in the university. But of course, students can be co-applicants or part of a grant as well. We don't have specific student grants, as far as I understand, at least not in innovation. What do you know, Rasmus?
Yeah, we have just one real student grant, which is 1-year scholarship grant but it is for health faculty students, where they get opportunity of having up to 1-year research project next to their studies, or actually instead of their studies. But it's not a common thing. It is really only for health faculty. Yeah. But of course, students can be in larger research projects as with scholarships. I mean, they can be paid for with most of our large research grants.
Okay. Then now more questions are coming in, so that's great. I'll just ask one more question here. Julia Dalsgaard is asking, what if a company has a collaboration with a hospital or university regarding research, such as that the hospital will carry out their own research, but will be relevant for the company and may include some machinery, etc., from the company as part of the research? Do you understand the dilemma or question?
Yeah.
You want to start, Karin?
Yeah, I mean, I can just say that the very basics here is that the grant itself, it has to be governed and held, so to say, by a university or a university administration. So the grant could never go directly to a startup and or any company. But of course, we see a lot of researchers having collaborations with startups, and we of course are not going to say no to that. We also see a lot of researchers, university researchers, paying for CRO activities, for example, if they need help with certain parts of the research that they can't do themselves.
Yeah.
Yeah, also.
You're muted. Okay, sorry. Yes, thank you for that answer. I think in interest of time, we'll hide some of these questions for the end. So I will thank you, Karin and Rasmus, and I will just hand over the word. Just one more slide. Yeah, sorry. Yeah, to Marcus. So Marcus, please, from the Bioinnovation Institute, please take it away from here.
All right, thank you, Jesper. So my name is Marcus Herrgard. I'm the CTO at the Bioinnovation Institute. I'm not usually the one presenting these things, but I took our health tech business developers roles here. So apologies if I don't know all the answers, but I can point you to people who might. So good. So as Karin and Rasmus mentioned, we kind of envision ourselves coming after something that's a purely grant-based thing. So we support very early stage startups in health, in life science in general. And we come before any professional investor on the other side. So we like to position ourselves as basically a pre-seed investor in that sense. We have some known issues when you try to take some of this nice research either out at universities or other places where you might have generated an idea, is that it is quite difficult to turn research into business. You might have the best product idea, but you don't know how to sell it or where to even go to sell it or who would be interested in investing in it. The teams that come out of universities or research backgrounds otherwise usually have some lack of competencies, network, money, which is what we talk about here, and also potentially facilities where they can operate. And many startups die at many of the valleys of death, but I think most of them die before they even get off the ground. So people have an idea for something, but simply there isn't a way to finance even the very early stage. And that's where we come into play. So what we support is, as I mentioned, is early stage, the very early stages of a life science startup development. And we also are very much in the business of trying to build up the ecosystem in the greater Copenhagen region. So this ecosystem part is why we operate an incubation facility and why we organize events in normal times, a little bit less now, and things like that. So we see very much also a role for us in ecosystem building. We work primarily with startups that come out of academic environments with some IP, but also we are open to other research-based startups. But mostly our purpose is to sort of bridge from academia to business. Especially in health tech, we see quite a lot of companies that don't come with an academic founder, but come otherwise with a research-based idea, and this works fine for us. We have, as I mentioned, 4 things that we provide. And this is a bit different from, I think, most of the other programs here that are, or most of the other people who present. So we do other things than just funding. We provide our own knowledge, our partners' knowledge. We provide a very extensive network with both fixed partners as well as more loosely defined partners. We provide funding. I'll briefly talk about that. And we provide infrastructure finally, including labs and other office infrastructure. The part that's probably most unique is that every startup in our portfolio gets a business development anchor, and this is a professional business developer. We have a team of 8 business developers with different backgrounds from different fields, and they bring, of course, their knowledge. They're there to mentor. They're not there to fundraise for the company, but they also bring their network also as part of the equation, and as well as provide some of the key tools. So some of the things that we often work with startups is fundraising strategy, pitching, regulatory strategies, go-to-market strategies, all aspects of commercialization. In terms of our network, we work primarily with 3 kinds of partners. That's research institutions, primarily universities in Denmark. We work with business partners, either in the form of corporates, and this would be to expose startups to basically possible deal takers in the corporate world, at least to get feedback on what they're doing, but also to business acceleration partners. So basically partners that provide various services, whether that's technical services, legal, visual identity or communications, or other types of services. And then finally, we work a lot with venture capital because our primary exit route that we envision for most of the companies coming out of our programs is either seed or Series A financing. And here are some examples. So in research, we have fixed agreements with 3 universities. We keep adding more. Slowly, we might even go outside of Denmark at some point, but right now we're pretty happy with the Danish universities. Business, you can see a lot of law firms there and IP firms, as well as some corporate partners. We also provide business support in terms of commercial due diligence or commercial market research partners, as well as grant writing support for applying for soft money. And in terms of venture capital, we have 9 VC funds that are part of our permanent network as part of our advisory groups. And these funds we work actively. They see all of our portfolio from the day one, even before they come into our programs. They advise on what companies we select for the programs, and they also get to keep an eye on the companies. So basically in the form of regular pitches, opportunities for our companies to pitch to these funds. In addition, we are working with about 40 additional venture funds around the world in a more loosely defined network, basically where we organize some pitch events and the like for specific funds that target specific areas. And these funds cover biotherapeutics, so therapeutics funds, focused funds, health tech focused funds like Rock Health, medtech focused funds like BioVentures, and bioindustrials focused funds like the March Fund, as well as some general funds like Novo Holdings and NEA. We don't have any geographical preference for the funds, so we are mixing some local European funds with also US-based funds. We find this very useful because we also learn about how to operate our incubator from talking to people who will probably take the companies at some point. I should also point out that we don't keep anything exclusive to these funds. So we don't offer any exclusivity in any of our programs in the sense that there's no preference for the investment from our perspective. We will broker an investment deal with any fund that is providing a good return for the founders' efforts and gives a fair deal to the founders. Good. We also have infrastructure, which includes office-based lab facilities and some technical platforms. And that technical platforms are both contract research connections and some platforms at the universities that we have made some agreements with. So this is probably the interesting slide for most people. This is just the funding amounts. So we have 1 grant program, and this is currently invitation only. We will open it up a little bit. And that's basically a commercialization grant that's aimed to go from a fairly late stage research idea, similar to what would come out of some of the NNF programs that were just mentioned by Karen, and then to build a company together with the founder. This is only to universities and exclusively to relatively experienced people that have already basically done it in the past. Then we have 2 startup company facing programs called Venturelab and Creation House. As you can see, the amounts of money are a little bit different, and also the duration is different. And these are convertible loans. So technically, we're not soft money. So this means that there will be an equity conversion, but it will be on the terms of the investors that come later. So they decide how much our €500,000 is worth. So our 500,000 converts exactly to 500,000 in stock, and then whatever that the company's value can of course be much, much higher depending on what the valuation the investors want. But this of course also means that the company should aim for some reasonably sized investment. So our share is not very big. We do not intend to return investment in the sense that we are funded from non-profit money. We are funded by annual grants from the Novo Nordisk Foundation, so we do not have to basically make our portfolio return our investment in that sense. Just a second, I need to move the slide. The important difference between Creation House and Venturelab, the two funding programs, is it's pretty simple. Creation House, we aim for the companies to be able to get a Series A financing, which in our language means more than €10 million investment after they exit. And that is a quite high bar. For the Venturelab, we are more thinking of feeding some of the companies into Creation House from Venturelab, and some of them would raise seed financing. And seed financing in our language is €1 million or more, depending a bit on the field. So if it's health tech, it might be a bit less. And then the faculty program aims to go the whole way. We do not have very strong restrictions in the field. We will work on anything that we consider research-based. And research-based also means clinical research-based. So for health tech, that might be coming out of clinical research, not coming out of basic research at the university. And we work with health tech, bioindustrials, and therapeutics. We are strongest in therapeutics, but we are expanding quite a bit in the other areas too. And we're working on adding partnerships in all areas. We probably have a special soft spot for health tech companies that could envision working also with therapeutics companies, meaning pharma industry partnerships, because there we have a very, very strong network, so we can easily help companies. Good. We have worked, I don't have the brag sheets. We have worked with quite a lot of companies in the past in different programs. We currently have, it varies, every month the numbers change a bit, but we have close to 30 companies in a portfolio. Out of those, some have actually exited our active programs, and we rent space to them on a short-term basis as they are either getting the financing finalized or they're working on where to go next in their journey. We don't envision to do a huge amount of renting out space, but that's what we do currently. We usually keep between 10 and 20 companies in our active portfolio. This year we will accept 20 companies through our funding programs total, and then we will continue expanding actually up to 30 companies in the long run per year. This is our team, so we have quite a lot of people, as we have a large business development team. We also have a technical team, lab maintenance, facility maintenance, even IT nowadays, IP support, operations for all the finances, as well as project development support. But all of these people are basically there to serve all of the startups that work with us. Yeah, and this is my last slide. So probably the most important lesson is to sign up for our newsletter on our website, bii.dk. That's how you get to know about everything we do, about some success stories, some learnings also that we make. We regularly write short blog posting type things on that. You also find out about our open calls and how our companies are doing in case you are interested in that. We just closed our calls literally like today, yesterday. So now it's not the right time to go to the website to find the open call because it's not there yet. The next calls will open in mid-2021, so closer to the summer. You will see the information on the calls, and we will open calls for both Venturelab and Creation House. And to give you an idea of how, what are the odds of getting funded, so we had close to 100 applicants total for now what we will have 10 spots open. So the odds are reasonable, not not extremely low, but not extremely high either. So you should make a good effort. And something that's really important is to read the guidelines. We now publish very extensive guidelines on the core website on how to apply and what materials to provide and how your pitch deck should look like, and how we require both a pitch deck and we require a written narrative to go a little bit more into detail of what are you specifically going to do with the funding. Make sure to check the eligibility criteria. I will not run through the relatively elaborate setup we have there, but basically if you have hard investment from a professional investor, corporate, or a foundation, meaning equity-based investment or loan or convertible loan, you are not eligible. So we cannot take that because we are a non-profit. On the other hand, if you have angel investment or your own money or soft money, in most cases you are eligible unless the angel investment is extremely high. There's some limitations in if you have a very serious angel investment. We don't feel like that it makes sense for us to take you into our program because you probably can sort it out yourself. You can reach out. All of our email addresses are public on our website. The personnel list is public. Also, the roles of people are there. So what are individual people doing? We have specific people responsible for each one of our programs that are usually the primary contact points about that program. And that's usually the best way to do it, is to initially reach out to the individual program responsive, and then we work out from there who you should talk to if you need to know more. Good, so that's it for BII, and I'm happy to take any questions. Actually, companies outside of Denmark are eligible. We do have a special requirement that you have to also establish a Danish company, which might sound daunting, but establishing a company in Denmark takes you about 1 hour. It does require putting some capital on the account, and you need to secure the IP rights for that additional company. But we can work with a model where you have basically dual domicile in Denmark and outside of Denmark. In fact, it looks like more than 50% of applicants to our most recent round were outside of Denmark.
Excellent. Thank you for asking that question already.
I saw it coming, so I took it.
And thank you, Marcus, for a very great presentation. It's a fantastic range of opportunities you have for early stage startups. Very impressive. And we know startups have been through your cycle, through your programs, and they're very, very happy with them. So I can strongly encourage everybody on the call who is eligible to actually look for these programs. Any other questions? Please ask them in the chat, or if you don't have any other questions, we'll wait for them. And if you have questions later, we can take them at the end of it. Just give people a second. Now there's a question now coming in. Would you fund vaccine studies?
We would fund vaccine companies or companies developing vaccines. I mean, we do that already for cancer vaccines and the like. We don't fund specific studies, so we don't have a mechanism to give ad hoc grants to like clinical studies and the like. We work through the 3 programs we have. That's how we always work. Yeah. That's actually a good question, because we oftentimes get asked to support a part of a collaborative project, and then you are in the wrong place. You should go to the EU or maybe Innovationsfonden or NNF. We support the company as such, and you can set up your collaboration once you're part of our program, but we do not support a specific project as such.
All right, excellent. Thank you, Marcus, for a great overview. Now over to Sten from Innovationsfonden Denmark. Do you want to take control, Sten?
Yes, I have it now, I think. Yes, my name is Sten Bennike Mortensen, and I'm investment officer in Innovationsfonden Denmark. Why do we give away soft money? It has been discussed early by Jesper. And we give away money because there is an act on the Innovation Fund Denmark and what we have to do. We are the Innovation Fund, part of the Ministry of Higher Education and Science. What do we do then? We invest in entrepreneurs, researchers, and businesses that create value for Denmark and new solutions to our society's biggest challenge. And we do that by kind of giving away money, and we don't invest and we don't expect to get money back. We invest in sustainable solutions. We create the frameworks for entrepreneurs, researchers, and businesses so they can develop innovative and viable solutions to our society's changes. We want in the Innovation Fund to create real value from our investments. And we think that it's important that the Danish society benefits as much as possible for the money that the Innovation Fund invest in the research and so on. And we prioritize responsibility highly. We also have requirements of societal engagements and transparency, education, and ethics. And compared with some of the other investors, we don't necessarily need to see the share prices or the end of year financial results as a sign. We in Innovation Fund Denmark, we also evaluate on social welfare improvements, increased societal wealth, jobs, reduction of CO2 emissions, cleaner environment, and so on. And actually, yes.
Stig, maybe you can put on your camera. You forgot to turn it on.
Okay, I'll see that. So, and actually, in the Innovation Fund Denmark, we are ready to take a chance because we can see things that others may not be able to see the possibilities in. So the fund was actually created to invest in projects with high risk, but also with high potential. And we try to think that we do that in an easy, simple, and transparent way with as little bureaucracy as possible. This is actually an overview of our funding programs. To the left, you can see the partnerships, and we support partnerships between researchers and companies, regions, hospitals, and municipalities. And we have the first box, which is called grant solutions, where we typically would grant from 5 to 20 millions. Typically grant is about 13 million, and duration can be up to 5 years. There are 3 different types of grant solutions we have. We have the life science, health, welfare, technology, and clinical research, which currently for the next call can give away 180 million. Then we have the technology and innovation kind of leg, where there is 78 million. And last, we have the leg called green research, technology, development, and innovation, where there would be 100 million this year. Then below that, we have the international collaborations, because we also support projects that collaborate internationally. It could be within the European horizon. Well, it has been 2020, but now we have the horizon 2025. But we also have a long list of different international collaborations where if you are a partner from Denmark, you can get funded up to 300,000 euros if you are a Danish group. It could be a company, it could be a university, it could be a hospital. Then the last box over here is the industrial researcher, where we support up to 50% of the salary for a PhD or postdoc that works in between a company and a public organization like a university or a hospital. In the middle, we have support for startups. We have a place where we support maturation of research ideas that could end up as businesses. We have the Innovounder, which can be either Innovounder graduate, where you can go directly from university or on a higher education to try to start up your own company. You can get support with up to 15,000 crowns a month for a year. And then we have the Innovounder Experienced, where you have a few years of experience, and here you can get up to 30,000 crowns a month for a year. And you can be up to 3 people together in such an Innovounder. Below that, you can see the Explorer, which is meant for people from universities and hospitals that have a good idea. They want to kind of check whether you can actually mature it to a company, for example. And here you can get up to 1.5 million crowns for a year. To the right, we have the small medium enterprise boost. It's called InnoBooster. And it's for small companies that probably would like to, for example, get a new product on the market and test some new ideas, and they can get up to 5 million crowns for that purpose. Something new in 2021, as you can see, the green one, now we have Innomissions. Here has been set aside 700 million crowns meant to be giving to large partnerships, and in 2021 it's supposed to be within green investments. And these green investments can be, for example, within carbon capture, storage and use of CO2. It could be green fuels for transport, what's called Power to X. It could be climate and eco-friendly agriculture and food production, or it could be circular economy with focus on plastic waste and textiles. These will be more precisely described on our homepage in the coming period of time. We have the current portfolio in the Innovationsfonden Denmark is about 8 billion Danish crowns. We have more than 3,000 active investments. And just in 2020, we granted more than 1,000 active projects. In the Grand Solutions Health and Life Science, we have more than 90 active Grand Solution projects running. And for the Grand Solutions and the Innovations, we have in 21 1 billion Danish crowns. And then, as I mentioned, this year we will have 180 million Danish crowns in health and life science. This year's life science call has deadline on the 8th of April. And as I said, it's within life science, health, welfare, technology, and clinical research. And the specific call is that the Innovationsfonden Denmark's purpose here is to invest in ambitious, targeted, strategic, and challenge-driven research and innovation projects, developing knowledge-based and interdisciplinary solutions to specific challenges in Danish society that in the short or long term will create societal value and/or economic growth and employment in Denmark. As such, value creation is not only monetary gains, but can be value for society in the form of health economic parameters such as increased life expectancy, reduced disease and treatment burden, improved quality of life, in addition to reduced environmental impact, etc. And the budget that is 180 million, of these, 63.3 million actually has been set aside for clinical research that will address challenges in the health area and contribute to optimizing quality of patient treatment, disease prevention, health technology, and so on. And these challenges has been described in the Forsk 2025 catalog under better health. Of these 63 million, there will be used 25 million that should be allocated to a specific stem cell research center, which has significant international research and co-financing from public and private actors. When we get applications, we would assess them on 4 different criteria. One of the first criteria, of course, is the quality of the research and innovation that you propose. Is it clear, measurable, realistic, and achievable? You have to describe the state of the art, why this project will succeed in comparison with relevant work of others. What is actually the strategic relevance of the project from a Danish perspective? What have you been doing up till now? Pilot studies, prototypes, etc. Do you have a project description? You have to outline the workflow and organization description and the reasons for the methods you use. And then we come to the value creation, and said a couple of times until now, is not only the monetary, but also the societal impact you can have. But regarding to value, of course, it could be permanent jobs, it could be increased revenue for the company, it could be reduced costs for society, reduced environmental impact, and so on. And you can use quantitative or qualitative measurements. And of course, the more money you apply for, the higher the value creation has to be. You will also need a description of the efficiency of your project execution. Do you have a well-structured plan? Do you have quantitative milestones, deliverables, and stop-go criteria? And the stop-go criteria might be very important here to make sure that if you apply for a large amount of sum, we can make sure that if you not succeed the initial kind of plans, then we can stop the project. And since we invest in highly risky projects, you have to describe very clearly where are the risks and mitigations for your project, because there is some, otherwise you had money already. And then, of course, the description of the legal, ethical, and regulatory demands, because we see a lot that if you, for example, has to develop an app and something like that, then there might be very rigorous regulatory regulations that you have to take in consideration very early on in your project. And lastly, but not least, who will actually benefit directly and or indirectly from your project's outcome, and what will happen after the investment from the Innovationsfonden Denmark has ended, and how will the implementation of the results lead to the achieved value creation. And then we see sometimes that you can actually have score very highly on, for example, 3 of the 4th, but the fourth criteria might be very low. So you have to consider all the different criteria when you actually send an application. Here's a link to some of the actual kind of programs we have. The first one is the grant solutions, and here I've shown the life science, health, welfare technology, has a deadline on the 8th of April. What's important to notice here is that previous years we have had 2 rounds of applications, but this year we only have 1. Also because we have to use the rest of the year for the innovations. Then there would be a link to the Explorer, the Innovator Graduate, the InnoBooster. But also we have a range of international projects that are not listed here, but can be found on the webpage. We have several different calls within, for example, personalized medicines. We have bilateral collaborations between Denmark and China, for example. But right now we have several of these applications on the homepage. Here, I just included the links if you get the presentation afterwards, but look at the Innovationsfonden Denmark homepage. There will be a description of the programs and the deadlines, and there will be a lot of description on how to actually apply for money and how to do it. And there will be a list of names on the different people and the email addresses, so you can always contact us. Yes. Questions?
Thank you so much, Steen. A great presentation and very interesting, and some timely deadlines as well. I think there's 2 or 3 good questions in the chat. And one of them is, the first one is from Julie, and that is for the Innofounder. What if you're a recent graduate but did not found the company and you're the CEO instead? Can you then apply?
Yes.
Okay, so Julie, you can apply. And then another question from Brian Lose. What if the company is Danish, a Danish entity, but it is going, and the product is going to be developed in Denmark, but the future product aims to solve a problem outside Denmark, for example, in the developing countries?
It doesn't matter, because you would, if you have your production, you have your research, you have everything in Denmark, you would eventually create a lot of revenue because you have to employ people, and that way you actually create value.
Okay, excellent. Sounds reasonable and good.
Yeah.
And then Charlie asked if the recording for the event will be shared afterwards. It will. Charlie will be on our homepage as well. Then Søren Kleber asked, we heard from a consultant that Innovationsfonden reject all project applications that contain the word app. Yeah, apparently too many, and now it's just a turn off word to avoid in the application. Can you confirm if this is true?
No, I can certainly not. We have currently supported several very good apps that are working, and we will also support apps in the future. But you have to be quite sure that when you actually apply for something that involves apps, that you are certain that you will be able to handle all the regulatory stuff and the GDPR things that are involved here, and it's not a trivial task. No. And I of course, when you look at apps, you cannot bombard everybody with tons of apps. So somehow there'll need to be you have to do it smart in order to probably collaborate with other people, I guess.
Yes, makes sense. Then Mads Grünewald Tandrup asks, what's the ideal applicant for the grant solution? And is it for startups, or is it, so I think the question is, can a startup actually apply for grant solutions, or do you have to be a different type of organization to apply for grant solution?
Of course, it's possible, but as stated, we actually look at what have you been done until now. If you are a startup, depends. If you come from, for example, from university, probably Innoexplore would be best for a startup. Or you could use some of the other programs. But if you have collaborations with other companies, universities, hospitals, GTVs, whatever, then of course you, as one of the partner, could be a startup. That's no problem. But of course, when we look at the kind of reasonable success kind of chances, then we have to evaluate the company as such. Are you the correct partner in this project?
Yes. Then there's a question from Ella. Again, is it only university employees that can apply for Innoexplorer?
And hospitals, and yeah, it's people from the public sector. Yes. And you typically have to, where you are located, there would be an office that would recommend you, so that you actually have the possibility to apply for the grants. So that would be a selection procedure locally, for example, at University of Aarhus and so on. So you cannot just apply. There will be a certain number from each part of the country that can actually send applications to the Innoexplorer.
Okay. Then there's a question as well from, we have a startup in Sweden. Can we apply for this fund? Is it only for Danish entities?
No, if you collaborate with Danish hospitals, you can. And I have to say that typically when we actually, when we handle the money, then typically we would have a main, one of the applicants, typically a university or hospital, that would handle the money. And then they would actually direct it to the other partners. So typically we would not directly, give 20 million to a little startup company somewhere in Denmark, but we would, have it administered through the university or through the hospital.
Okay, excellent. Then last question. Is it true that it's from Simona? Is it true that biomarker-based innovation projects are most often rejected because they take longer time to develop? What could give an extra chance for such a project to the InnoExplorer program?
What we always look at on also in the InnoExplorer program is how far are you currently? Because if you have a brilliant idea, then of course it's real nice, but we would like to have some hard facts on where are you in the development phase. Do we really believe on your project? So we don't go with just the idea, but I think the most important thing is that you clearly described where do you start and where do you expect to end after your project period. For example, in InnoExplorer, you take 1 year. So where do you start and where do you expect to go? So you'd have to be very realistic about what you can achieve in the period where you get the money. Then it's okay to say after that I'll go to the BII or someplace else where we can do something different. Because we don't expect to carry the project from start to end. We are sitting in the middle. We are sitting a little after basic research, and then we are before actually venture capital.
Excellent. Thank you, Sten. That was a great answer. Thank you so much, Sten. We'll come back to Sten. So if you have more questions for Sten or the Innovation Fund, then hide them for the end, where we'll have a 20-minute session as well. So now it's an honor to introduce two gentlemen from EIT Health, Christos and Per. Christos and Per, you should take control of the presentation in the top corner, and then you can change the slides.
Yeah, I think I did. Or maybe I. Hello, everyone.
Yes.
It seems to be working. Right.
Yes, it works, Per, and we can see you
great.
and the slides.
Okay. Yeah, my name is Per Horn, and I work together with Christos Vaitis in EIT Health. And we are here today to present the opportunities for you within EIT Health. And we are very pleased to be invited and to be in such a prominent company, so to speak, with the Bioinnovation Institute, the Novo Nordisk Foundation, and the Innovationsfonden Denmark, and of course, not the least, all the listeners, you guys, representing the future of health tech in the Nordic region. Before we go on, I want to start by saying, and you're probably aware of it, that investments in health tech actually saw a huge increase of 750 million euros from 2019 to 2020 in various areas such as telemedicine and home care solution. Mental health solutions are being commercialized at high pace. The company Triumph Health, I don't know if it rings a bell, is an excellent example of that. They offer an app-based solution for behavioral and psychological support to children. We also saw AI and machine learning being implemented at a higher pace, imaging tools for X-rays, CT scans, to improve accuracy in screening and diagnosis of cancer and heart failure. Radiobotics is a good example of that. And health tech companies are also entering the field of rehabilitation and preventive care, such as tracker devices and support systems to guide medicine and nutritional intake, or to monitor just general state of health. And also nowadays, due to the pandemic, obviously people are staying much more at home. So occupational health solutions are increasing, mainly developing safer and healthier workplace. And these development investments in health tech have, of course, been due to, in large part, to the pandemic situation. So in times of crisis, there are also great opportunities and interesting business cases. So this is a very good time to be in health tech. And when that's said, that will be kind of the entry into EIT Health. And some of you know EIT Health and many of you probably don't. So I'll give you a very brief introduction. Now, what you see here is an overview of EIT Health. It was established in 2015, and it has organized itself in 7 regional innovation hubs and what we call InnoStars. So we are currently present in 17 different countries, meaning that there is a local EIT Health office almost no matter where you are in Europe. EIT Health is partner-based. It's a partner-based funding, support, and network organization where partners are coming from industry, healthcare, research institutions, incubators, universities, and public sector organizations. And we practically cover the whole journey from patient to payer, both in terms of the range of partners, but also in terms of the programs we have. And we like to think of ourselves as being a catalyst for innovation and societal impact in Europe. We have a wealth of programs, and we have 3 pillars, each with their own programs. Each of the 3 pillars has its own focus areas and target groups, but they are to a certain extent constructed to support each other and overlap. So isolated, the Accelerator Pillar, which I am going to present today, mainly addresses startups and provides programs with funding and very specific mentoring and other kinds of support. And I will get back to that a little bit later. Yeah, and the Scandinavian part of EIT Health was established in 2016, and since the inception, we have supported more than 145 startups, and these have combined managed to raise more than 30 million euros. And we have now started to focus much more on supporting companies in relation to raising investments or funding. So these numbers are hopefully rising in the future. In terms of thematic focus areas, we have divided them into these 3. EIT Health is looking towards medtech, digital health, and biotech solutions, where biotech solution is mainly biomarkers or digitalization of biomarkers and personalized medicine. And some of the companies that we have supported already and funded in the past include Triumph Health, as mentioned before, Hi-Rasmus, Paragit Solutions, SyncSense, Ward 24/7, Volker Medtech, and Saninotch, to mention just a few of the ones that you might be familiar with. Okay, there's something wrong with that slide. Oh, there it is. I didn't know there was an animation there. Okay, but the best way to illustrate how funding and support from the EIT Health Accelerator program works for startups like yours is to imagine a journey going from early stage projects, even before being incorporated, up until market expansion or raising serious finance. So the programs you can apply for depend very much on the stage of maturity and needs of your project or company. So the best way to navigate the amount of programs we can offer is to clearly define what is needed for you to get to the next level. And it's not a surprise, that goes for all funding programs, I suppose. But what you need to define is can be in terms of regulatory issues, such as classification of your solution, clinical route of approval, and it can also be in relation to market or competitor analysis, whether it could be good for you to partner up with complementary experts or solutions, or even whether to continue with your solution at all. It could also be how to gain market entry, reimbursement rules and codes, validation of business plans, market expansion, scaling of solution, and investments, seed, Series A, B, IPO. It can be anything. And when you have identified this, you can either visit our homepage to find the relevant program, or you can contact your regional innovation office, which means contact me and Krista. So then we will, together with you, discuss the opportunities for entering one of our programs. So to get a little bit more into detail about our programs. Oh, I didn't know there was an animation here, actually. The reason why I told you about how to define your needs in terms of regulatory issues and all the other things I mentioned is that not all our programs comes with funding. Now I have on the left side of this slide, I have listed some of our programs, starting with the wildcard on the top left. Also shown on the left side is a color code that is linked to the kind of funding or support you will receive through the programs. And you can see that only the wildcard and the amplifier programs actually come with the access to funding for research and development activities. All other programs present companies to a range of tutors, mentors, and experts in various fields, and all are providing valuable inputs to accelerating and growing your company. Whether that be demonstration of proof of concept, validation of the project, scaling, or raising investments. The important thing for choosing the right program for you is to know your maturity level, your needs, and what it will take to reach the next important milestone or value inflection point. If you don't know that, we can help you with that and guide you to a potential program of relevance for your project and company. As you also see in the table, that the various programs are divided into maturity levels of the company. If you are in the incubation phase, validation phase, scaling, or fundraising phase. And obviously many of these phases are overlapping, and most companies are often in the fundraising phase. But if we go through the program, starting with the wildcard program, this program targets very early stage companies or even late stage academic projects. It's a program offering 1.5 million euros and a range of experts available to the team over a course of 2 years. So you can think of that program as a team surrounding and guiding the founder team to achieve commercial success at a highly accelerated pace. This year, the wildcard program focuses on eye and vision care and pain management. So if you work in any of those two fields, this program might be very interesting for you. The bootcamp programs are targeting startups and entrepreneurs, and these startups and entrepreneurs will then participate in 2 to 8 weeks of very intensive courses, depending on which bootcamp they participate in. And the topics are leadership, fundraising, and entrepreneurship in one bootcamp, business model design in another bootcamp, training for pitching in front of investors and experts in a third bootcamp, and so on. We have 5 bootcamps in total, and you can look them up on our homepage or get in contact with Christus and I if they seem relevant to you. The MCN, or the Mentoring and Coaching Network, is a program where you gain access to experts who can guide you in achieving your next milestone. And that next milestone could be regulatory approval, CE marking, or something else. And also we have the Startup Meets Pharma, which is a challenge program. We also have Startup Meets Healthcare Providers, which is also challenge programs, where in this case, the pharmaceutical companies such as Amgen, AstraZeneca, Merck, or Takeda, it could be anyone, but this year it's those 4. They put up some challenges in relation to identification and screening of patients, for example, early diagnosis and prevention, digital remote monitoring, and personalized health for adult attention deficit hyperactivity disorder. There are several challenges here. You can get more information on the website, or you can visit us. But these are programs where startups are invited together with the pharmaceutical companies to actually meet those challenges. I will skip the Amplifier program because the deadline for that has passed, and there's a call once a year. The next will be in January next year. But then we have the Bridgehead program. It provides you with experts that can help you expand from one European market to another, or even outside Europe. We have a couple of those programs. Then we have the Gold Track and Catapult programs, which are highly efficient programs that make you investor ready. And if you are already investor ready, the crowdfunding, investor network, and the VCOE might be programs for you. And I don't actually want to go into more details about each of the program types we have, but I hope that I have given you an idea of the range of programs we have, and that we have programs for almost any maturity level of the company. So if you're interested in any of these programs and want to hear more, you are more than welcome to contact both Christus and me for a detailed discussion on which program that will suit you. It's one of the advantages of EIT Health is that you have a person of contact. You can always contact, and they will guide you straight to the program that is for you. And that's actually all I will say for now. And thanks for listening. I hope it was informative enough, given the time we had. And we are open for any questions you might have now and in the future. Thanks again. Thanks for listening. And thanks for inviting.
Thank you, Per. This was really good, and impressive lineup of initiatives you have. Not only slides, but maybe you need to mute yourself. Yeah, sorry, not yeah. Very impressive lineup of initiatives. We know many of our startups have been through various programs, EIT Health.
You're falling out, Jesper. I can't hear anything actually.
I think there was somebody joined who didn't mute, but I muted him now. So sorry, I was trying to say, Per, it's a very impressive lineup of initiatives you have. Not only money initiatives, but also concrete help, and various both disease areas and expert areas. So, and I know from experience that many of the startups who've been through your programs are very happy with them. So I can definitely also strongly recommend them to anybody on the call. So any questions out there?
I can actually just add very quickly here, if I can, Jesper, very quickly.
Of course, Christos.
That, for example, Per mentioned the Bridgehead program, which helps companies enter a new European market or a new market outside Europe. So Health Tech Cup Copenhagen is one of the entities supporting companies from other European countries who want to enter Denmark. So and just a little bit background on that. So this program is a very big network of incubators, innovation clusters, accelerators, or whatever entities that support companies who want to make a soft landing. So you know Health Tech Cup Copenhagen very well, and we're very pleased to collaborate with you guys on that. So the startups here, for example, can imagine similar organizations that if they want to enter this program, that they will get help from similar organizations from other European countries. So it was just a small note.
Yes, thank you. Yeah, and I think that is an important, also one of the areas where you're different than the three other speakers is that both you have local presence in Denmark, but you have local presence in all the countries, and you have people on the ground in all markets, which is a huge benefit for many startups. There's one question from Yannick, and that is this part of EU Horizon?
Yes, we have been part of Horizon 2020 so far, and we are obviously now transferring into Horizon Europe. So,
okay. Any other questions from EIT Health? No further questions then. Then I'll just take control, and then I'll open up the floor for any questions to anything. To any of the speakers out there, so you can ask questions for anyone here. Any burning questions? How do you any programs that are interesting? Any tips and tricks that you didn't hear to increase your chances of success in these programs? There's a question now from Jens. Is EIT crowdfunding closed for this year? That's for Christos and Per.
Yeah. No, I can reply if that's okay. No, it's open for applications throughout the whole year, so it's not closed at all. If you have any issues with or if you find a link that says it's closed or whatever, just contact us and we will help you. But it is open.
And then Pernille asked a good question as well. Can you participate at a bootcamp from EIT if you are also on an Explorer project aimed at establishing a startup company? Do you understand the question?
Yeah, I'm not actually familiar with the InnoExplorer term, but
it's a Danish Innovation Fund project or support.
Yeah. So I can say now, this is a good question, because I can say that whatever a startup or a team participate in a bootcamp or any other program in EIT Health counts against EIT Health support. So there's no conflict with other instruments in other countries, even with other EU instruments. So if you get, for example, a funding from EIC or EU instrument phase 2 or whatever, there's no conflict, so you can do both. So whatever you do in EIT Health stays in EIT Health. Let's say whatever we say in Vegas stays in Vegas. It doesn't go outside of it.
Yes, excellent. Yes. Any other questions? Anila is also responding. She liked that response.
You're welcome.
Otherwise, I'll just scroll up because there was a few questions, and please ask other questions and think about your question. There was a few questions that I didn't have to ask again up front. Sorry. I think this was a question also for the Novo Nordisk Foundation. So if you're a startup from Egypt, can you apply for the Novo Nordisk Foundations or researchers from Egypt? You know, not a commercial startups, but the Novo Nordisk Foundation programs, are they eligible for entities or universities outside, researchers outside Denmark? Question mark.
So I can maybe start with that. I think that's a very good question. Of course, the Novo Nordisk Foundation research grants are really for researchers or for research to be carried out in Denmark or in the Scandinavian, the Nordic countries when you are main applicant. So you should be associated to one of those. But there are a few kind of exceptions, which is, first of all, that we do have a number of international recruitment grants. We have laureates research grants, and we have young investigator awards that allows researchers from abroad to come to Denmark to establish their research career and lab, and those are actually substantial grants. For example, the small one of those, 25 million for 7 years to establish a lab in Denmark. So if you're in Egypt, you can apply for those together with a Danish research institution. And the other thing is that even though you have to be located as main applicant in Denmark or the Scandinavian countries, most of our larger grants allow to collaborate with research anywhere in the world. So you can perfectly well collaborate via one of these grants from Denmark or Scandinavia out to Egypt or anywhere else. So there are options, and that also means money going from Denmark to, for example, Egypt via those grants.
Then, and this is a question for everybody here in the panel. We have someone from India. They have a startup in India, and they have a proof of concept ready for a unique medical device with 500 devices tested in the field. And they're asking, are there any funding provided by universities? So is it possible to the way I read the question, Mano, and please correct me if I'm wrong, is that, you know, can you also support proof of concept studies from like Indian or other players outside Europe?
I can answer that from the Innovation Fund Denmark, that we actually have a specific international collaboration with India. So if you are on that call and you find a Danish hospital that would want to test that, for example, for you, then you could have a collaboration.
Okay, that was a great answer. Anybody else who want to?
Yeah, I can also pitch in from EIT Health to perform these kind of studies. I didn't get whether they should be performed in India or whether Europe would be okay. It's important for EIT Health to have its foundation in Europe. So you will need to have some of our EIT Health partners on board, and you will have to do it through our programs and most likely the innovation programs that we haven't covered today, which are large grants as well in the range of 20 to 25 million kroners. And then there's no problem in carrying out the clinical study in India if it makes sense. If it could as well has been performed in Europe at the same price, then we will probably prefer it being performed in Europe. But there's no problem.
Okay. Then thank you all. Any other responses?
I guess I can also just clarify further. So we require some presence in Denmark and a company to be registered, but there can be a company elsewhere too, but there does need to be a Danish company, and at least one person needs to be working out of Denmark for us to be able to grant money. I mean, we don't give money abroad from the Bioinnovation Institute. We otherwise do not have restrictions on where the work is performed. Much of the work nowadays gets performed in somewhere elsewhere for most companies, wherever it's convenient or cost effective.
Excellent. And Mano, please also reach out to us at Health Tech Hub Copenhagen about your product, and maybe we can introduce you to some people at the hospitals. We have several collaborations with many of the Danish hospitals there, so maybe we can help you connect with the right people at a Danish hospital to get to apply for the funding for the Innovation Fund as well. Okay, there was another good question from Vasim here, and that was to EIT. Can EIT Health help to find co-founders or other actors with same interest? So are you helping with that type of request as well?
Yes, we do. We have an alumni network of 30 to 40,000 people and a place called a talent marketplace. And we have databases and search engines and a network that allows us to do these kind of things as well, to actually find talents, to find the right people at the right time for your company. So please get in contact if you have any specific needs.
Okay, that's a great offer, and that's actually an offer we get all the time. So please send us the link to where people can read more about this, because I think this is something that many people. Many startups have this wish to find a great co-founder that can complement them. So that's a fantastic offering you have there.
I also, from the BII side, I can fully support. This is something that we constantly have to work on with the startups. Typically, the team is not fully there, or some parts are missing. So we work both internally, and we also use external recruiters and consultants to figure out if the team has the right competencies, and then to help to assemble the team for fundraising in mind, in particular from the perspective of VC funds. So we typically ask our VC funds partners also for an opinion, what they think about the team. Would they fund this team as it currently stands? The products are usually good that we see. The challenge is almost always with the team, whether somebody will trust the team with a lot of money in the long run.
Okay. Well, that's great, Marcus. So this just a follow-up question to what you just said there, Marcus. Does that mean that the person who asked this question, or any other startup who say, hey, we know we might be 2 people, but we are missing a CTO or whatever, they can still apply for your programs and just say that we know we are missing this person, but maybe you can help us if we get into your program to help us find this person.
Right. Yes. So I mean, with the earlier stage program, Venturelab, we're willing to live without even a very decent CEO, as long as there is otherwise a technical or let's say clinical technical team in place. For the more mature program, Creation House, you definitely need somebody who can take already the fundraising, but it might be missing some other pieces. Maybe you don't have a regulatory expertise, or the medical expertise is lacking, and that's something that we commonly have to provide. So that it depends a bit, but we try to keep it open in the sense that people can apply with very limited team, some commercial background is probably needed to prepare the application. So you will need at least to have somebody who understands a bit commercial market analysis to prepare a good application to our programs. That much I would warn, that if you write a straight research application, then it's way too early. Then you need to at least think of the commercial case.
Excellent. Then there's a question from Pernille, and I just moved up my chain, so I need to look at it. It was a question to Innovationsfonden Denmark. Would you increase your chances to get an InnoBooster if you have succeeded in getting an InnoExplorer prior to establishing a startup?
I would say that it might be nice, because then you have shown that you have progressed one step further, and we would really like to see our different programs interact. So meaning that you can start with one of them and then continue. Probably not all of them, but completing an InnoExplorer could be very nice for the next step.
Okay, and a similar question also for you, Sten, and that's from Julia. She's asking, are you eligible for the Innofounder if you already have been granted an InnoBooster?
There are, of course, specific rules for how to get these grants, and you have to look on them, because it looks a little bit strange that you go from this one to the other one. But you can write me a mail, and then we can look at it.
Okay. And then there's okay, thank you for that question. So thank you for that answer. So you can write Sten about that directly. Then there's an open question, I think a piece of advice Ulrik needs. Ulrik is asking, I'm from a startup in Denmark, and Danish medical students are already using our product for supervision purposes. We now want to extend our product and expand our market in the health industry. Would it make sense to go to the Innovation Fund or EIT? Very open question.
I don't know, Sten, if you want to go on, but I can certainly say that we have several programs to address this, and that would be, including experts in scaling purposes and market entry. So you can get in contact with us, and we will guide you to a relevant program. We have several programs for this kind of purpose.
Yeah, I would say that if you want to make your product, make a new niche for your product to use it in another way, then it would be Innovationsfonden Denmark. But if you just want to extend the marketing, then probably EIT would be better.
Sorry, just change this. Okay. Ulrik is thanking. Any other questions? Yannick is asking another question. How much business development do you need to have in place for an InnoExplorer application? So it's again for you, Sten.
It's difficult to answer very precisely, because the most important stuff is that your idea are viable. Do you believe that you have the correct idea? Because we sometimes see that people focus a lot on the business development part instead of focusing on the original idea, to see that we have the compound X and now we want to expand the market, and then we ask, what is compound X? So probably compound X is more important than the business development part.
Yeah. All right. Any last questions? Hurry up. Oh, Mads grabbed it. The wildcard EIT program states that the startup cannot be older than 1 year. Is that from the date of the CVR number was filed, or is it more broad when you started the activities?
Yes, that's from the year of incorporation. It's addressing very early startups, and another requirement is also that it cannot have any full-time employees at the moment. So it is very early stage. It's to accommodate academics, single persons from academics or teams from academics in really scaling up or getting their project off the ground towards commercial success.
All right. I think I'm calling it now. If there's no other questions coming in, let me then finish up with a few closing remarks. Before I promote ourselves as well, I definitely want to thank the speakers. I think you have done a fantastic job. It's amazing how many opportunities, concrete opportunities, concrete deadlines, concrete programs that you have highlighted and shared with us. There's really a wealth of opportunities, and I personally think there are many great things about health tech. You know, all the startups here and all the people who are in the call. You know, if you're working within health tech, you know, we're meeting a real need. You know, we are improving life quality for patients and families and employees in the sector. We can save lives. We can increase access to healthcare for people who have poor access. We can increase equality in healthcare. We can save costs to be used better elsewhere. And now we can all even get free money and free advice to develop our ideas and businesses. I think that's what is not to like about all this. We will send you the slides. The event was recorded, so you can tip a friend or co-founder to see it, and we will make the event available on our homepage. If you're interested in similar events or other events around health tech, please sign up to our newsletter. There's a link in the chat. You can also follow us on LinkedIn. And we have another event coming up around MDR and also with the Ministry of Foreign Affairs about how you go outside Denmark and use the embassies the 11th of March. And the 5th of March, we have this event around MDD and MDR, so regulatory approval, which is a very important area. Also something to think of early when you're starting up. So the sooner, even though maybe you're not there yet, it's wise to think about it if you're in that area that requires regulatory approval. So I think with these words, I want to thank you all. Thanks for your time. Please send us, if you didn't have your time to put in your question, if you have a question tomorrow or later today, please send it to us and we'll try to redirect it to the speakers. We hope you got some good value out of your almost 2 hours, 1 hour and 42 minutes. So hopefully this can give you a better background, or better information about all the possibilities that are out there for advisors and soft money and great network. Thank you so much, everybody, and thanks to the presenters again. Bye-bye.